Finding Links, Relationships and Health. Timmy Talk by Alida.
Welcome, everyone. This is session number 10 of Find the Link Relationships. It's been amazing. Thank you all for coming early. My name is Timmy Talk by Praising Child, and we have 4 amazing speakers here today. And I think we're going to have a really great time. So all the speakers have made you co-hosts. If you're not speaking and you're in the mood to admit people, feel free, but there's someone else that would be admitting. And I will just go to my slide shortly. Let's make that big. Okay, so today we're talking about relationships and health. We've had 10 amazing topics. At the end, I think I would leave the floor open for people to tell us what the previous 9 have been, hoping everybody has been paying attention. So this is about relationships and health. Quite interesting topic, because relationships are one thing, health's another. And we have these great speakers here today, Dr. Akintunde Orunmuyi, Dr. Shola Fatola, Dr. Mojisola Adeniji, Dr. Amy Ibare, and myself, but I'm hosting. I happen to be a doctor too, for those that did not know. And I apologize, I am not using the edited poster on here. So I think I've gotten some spellings wrong. Apologies, Amy and Moji. Okay, and Dr. Shola Adewumi is a general practitioner. Dr. Akintunde Orunmuyi is a nuclear physician and does have some special interest in men's issues. And Dr. Amy Ibare is an obstetrician and gynecologist, almost done, but she's as good as done. I've worked with her before, and I'll talk about her much later again. And then there's Dr. Mojisola Adeniji, who is taking mental health, and she is a psychiatrist. And I am in general practice as well. Quarter to done. Okay, so there is strong evidence that our health significantly affects our relationships, and our relationships affect our health. Good relationships make us more healthy. Staying in toxic relationships harm our health. It's also helpful to take deliberate steps to have knowledge about our health conditions and optimize our health to enjoy our relationships for much longer. Okay, and we'll be going to the first session by Dr. Shola Fatola, who is a GP based in Manchester. And we come back a long way, all the way from University of Ibadan, the great university. And I would like you to start speaking if you don't mind. Thank you very much. I will just stop sharing the screen now so that we can all just focus on your face.
Hi, everyone.
Hello.
I want to say thanks to Timmy for this opportunity, and it's good to see some familiar faces as well and to see everyone. All right, so I'll just delve into what I've got for today. So talking about general health and how it can affect relationship and how we can support if we have spouses or friends and families, we've got some of these medical conditions. Okay, so the first thing I'll be speaking about is about diabetes, which is very, very popular. Diabetes is just simply when there's an excess level of sugar in the blood, and it's a lifelong condition. This is because what happens usually is because the body is unable to break down the sugar that we eat to convert it to energy. So accumulation of it causes some symptoms and also causes complications. Broadly, there are 2 types, type 1 and 2, but I wouldn't go into details. For what we need to know is that for people who are above 40 years, commonly have the type 2 diabetes. General symptoms that people usually have: they feel very thirsty, they pee more than normal, especially at night, they feel tired and lethargic. There is also weight loss, and a particular thing that may affect relationship as well. If in marriage, it does causes itching around the penis, around the vagina, regular episodes of thrush. Risk factors is that diabetes strongly runs in families. So if you've got mom or dad who's got it, then there's a possibility. And it's also common in Blacks and in Asian families. And now, in terms of the complication of diabetes, complications that we need to know, like I said, excess level of that sugar accumulates in some organs of the body and sometimes causes these organs to malfunction. One of the organs is the eyes. So when you start noticing changes in vision, that's one of the complications, especially for people who have had the diabetes for more than 10 years. Even in the kidney, also there could be regular wound because it does affect the sensation, the senses and the nerves, and it deadens them such that people with diabetes and are having problems with their sensation. When they step on even sharp objects, they don't know, they can't sense it because the excess level of sugar have actually made these nerves dead. It can also affect erection. So causes erectile dysfunction, which is very, very important when you have somebody with diabetes to help and educate yourself about it, but we come to that shortly. Also, one of the complications could even be hypoglycemia, which means you're having, instead of the sugar becoming excessive, now it becomes very low. And such symptoms are very life-threatening, which includes confusion, weakness, the feel sweaty, feeling of hunger. But if care is not taken and you don't know what to do, it can lead to death because it's life-threatening and very, very quickly. And that brings me down to how we can manage it, especially if we've got friends, if we've got families, if we've got spouses, even if it's your neighbor. I think it would be very important that we get inquisitive and know about it because it's very common. Now, the first thing I usually advise is family and carers should have appropriate education. Try to go out of your way to learn about it. Try to go out of your way to know about it because you don't know when you can be of help. You can be of help when they have that hypoglycemic symptom, which is life-threatening. All you need to do is just give them any sugary drink, even if it's a sweet. Open the mouth because they become confused. They lose consciousness very fast. All you need to do is just give them sugar. But if you don't know, unfortunately, I lost a friend's mom this year due to hypoglycemia. Unfortunately, nobody knew this was what she had. So that low sugar may just even be the first presentation. But if you don't know, even if somebody had given us something at that particular time, we may not have lost her. But unfortunately, before she got into the hospital, she died. And by the way, it's in Nigeria and it can happen anywhere. So if you don't have that information, then there's no way you can be of help. Another thing is people who have it as well, when they go for regular checkup, they're given medication. Some of them, depending on the type of diabetes, they give them injection. So making sure that they are compliant with their medication, be very supportive, because a lot of people who have chronic illnesses, after a while, they feel bored. After a while, they feel depressed. They just feel, why can't I eat what other people are eating? Why can't I do what other people are doing? So we need to be very supportive. That's not the time to say you're an adult, you should be able to look after yourself. You should be able to take care of yourself. But with family and friends, with spouses support, they usually are very compliant and they always want to do things. Their checkup, they need to be having checkup every year to check their feet, to check their eyes, to do blood tests and check their kidney. This is very important as well. Most of our patients here in the UK, if you ask the men, what they will tell you is, if you ask them what medication, oh, my missus knows. Oh, my missus, everything is their missus. Oh, my missus. And if they come into the consultation room with this so-called missus, you will think it's the missus that has this problem because she has every record of the last blood test, this and that and that and this. So to be honest, which is very amusing and very exciting. So there is power in sharing things like this, having so much information. Sometimes if you know that your spouse is not a record keeper, I think there are just some things that you can do, because whether you like it or not, if anything happens to them, automatically it falls back to you. So prevention is better than cure. Also, I've talked about regular checkup. Now, erectile dysfunction. So like I says, it does affect that as well. And definitely if there's problem with erection, then there's a problem in the other room. So, and so again, there's help for this. With erectile dysfunction, speak with your doctor. People are usually prescribed Viagra, but Viagra on its own as well has got some contraindication, which means it may not be safe for you to use it. So don't just go and buy Viagra over the counter. Your doctor must be able to say, oh, it's safe for you, or if it's not safe for you. If you've had a heart problem before, it may not be safe. So speak with your doctor, but there's help. There's help, because once sexuality is affected in a relationship, sexuality is a very strong issue when it comes to relationship. And when this is affected, but because you don't know that, okay, maybe it's because my spouse has got this condition and this is what we can do, then it becomes a big issue. So that's that about that. And I think that's diabetes covered, I think, supposedly. Okay, so the next long-term condition I'll be speaking about is about high blood pressure, which is also known as hypertension. And this simply means when the blood pressure in the blood pipe, which we call vessels, is consistently high for a particular age. So with people who are less than, with people who are less than 80 years of age, anything less than 140 or 190 is okay. But when somebody is more than 80 years, our grandmas, grandpas, more than 150 upper reading and more than 90 lower reading, it's okay for them, okay? But usually people in their 40s or less than 40s, between 90 to 120 upper reading and 80 to 90 lower reading is the general reading, okay? And that's quite normal. Now, one thing about high blood pressure is that it has really noticeable symptoms. You may not feel anything, no symptoms at all. However, common symptoms that people usually feel is having headache, okay? And sometimes it can just be sudden weakness in the face or in the hands and legs, which is stroke. So they may not have anything. So they just have stroke, and then that's when they know that they've got this high blood pressure. So that's why it's very, very important. Anybody who is more than 40, always book an appointment with the doctor. Check, even if they tell you it's okay this year, it's an annual thing, go next year. I don't know how much it costs in Nigeria, but if you look at how much it costs compared to what you need to stay in the hospital when you get admitted, I think prevention will be better than cure. So always check, because hypertension doesn't have any symptoms at all. So again, the risk factor is that it's common in Blacks, people who are overweight, okay? And another risk factor is that when people eat too much salt, like Nigerians, we can't do without salt anyway. So too much salt, you have to take care. Yeah, complications like when there's extra strain in any of the blood vessel, which is hypertension or high blood pressure, some of the complications, it can lead to heart attack. Okay, again, that is sudden, because you don't even know if you have the high blood pressure, you just have heart attack, and then they will just measure your blood pressure and they will see that, oh, this person has got a high blood pressure. Also stroke, I've talked about stroke. Again, it affects erection. So I'm still going to be linking it with relationship. So how do we manage this? Again, family and carers should have appropriate education. Everything is on Google. Google is your professor. Fine, there are some things that you don't want to know on Google, but I do recommend there's a website, any medical condition that you come across, there's a website we use here in UK, and I've recommended to people in Nigeria, and it's really great. So like you say, high blood pressure, NHS, diabetes, NHS, okay? Obesity, NHS. And the reason why I like this website is that anybody can read it. It's simple English. You can read the management, you can read anything you want to know, but in clear terms, in simple English, no medical jargons at all. So I would recommend, if you want to know things about any medical condition, always just type the medical condition and NHS, okay? Again, with hypertension as well, most patients are on medication. So again, if your friends, families, always make sure that they're compliant with their medication. Also, they can get home devices, which is the blood pressure reading For people who have it, it's okay to have it at home and then just read maybe a week reading so that you can know what is happening with your own health as well. And also this is applicable to diabetes as well. There's a home reading device as well, which you can get and you can check regularly on your own, or family and friend can get. So again, presents, I'll just say that if you know anybody who has got this thing, who are not so compliant with their health, Christmas is coming, buy one and give it to them. You are doing them a whole lot of good rather than hamper. Get them all these devices, give it to them, and make sure you are calling and checking on them and saying, okay, are you doing okay? Have you checked it this morning? So that's about that. So again, I've talked about erectile dysfunction as well. If it affects erection, please see a doctor. Viagra is available for prescription, but make sure this is an advice on the advice of the doctor. Now, most of this medical condition as well, there are two clear things that are usually related to them, which is alcohol and smoking. So they increase the rate of all this chronic disease. So if you know anybody who is doing that, just try to tell them to cut off. Now, you don't say stop, because somebody who has been smoking for years and years, you can't just ask them to stop. You need to at least encourage them to cut down. So even if they're smoking 5 in a day and they're cutting down to 4, I can tell you that is significant. So support, love, compassion, empathy, that's very, very important. Again, I'll link this to the third thing I'll be talking about is increased cholesterol, which means high fat in the body, following fatty food. Okay, with hypertension, I'm just going to go back again and say just reduce or encourage them to reduce the amount of salt intake. That's very, very important. Fatty food, again, they cause high level of fats, and these fats block the blood pipe in our body, leading to, again, heart attack, again, stroke. So that's very, very important. And also talking about that also can increase the weight, leading to obesity. Things that patients can do on their own, importantly, regular exercise and healthy eating. Healthy eating, fruits and vegetables. I'm sure this is not new to us. Be conscious, be intentional about your eating, because recently, sometimes I will want to take some things and I will think to myself, this is poison. And then the thought of that just makes me stop. It's good to have treats once in a while, but if it starts affecting your health, then it's very dangerous, okay? So healthy eating and regular exercise. Everybody gives excuse, I don't have time for exercise. Oh, I remember my dad used to say, I'm 70, what kind of exercise do I want to do? Daddy, you will do exercise. So he goes on the treadmill and then he just does maybe a couple of minutes, but it's better than doing nothing. It's better than just sitting down. Now, for those who have stairs at home in Nigeria, I read about an 80-year-old woman, and what she does is, so she goes to the bottom of the stairs, just climb one, come down, climb one, come down. So by doing that, the blood is flowing. Just do about 10, 20, 30 a day. The blood is flowing. You don't have to go to the gym. There are so many exercises that you can do at home. Just open your YouTube and you can find exercises that is appropriate for you, and then you can do them. So again, common things that could happen with these conditions if they are not well treated. I've talked about heart attack. I've talked about stroke. So, and this is why it's important that we actually look after ourselves. Tell me, how many more minutes? I think I have one more to say. How many more minutes? I can't hear you. You're mute.
Maybe 2 more minutes or so,
okay,
because I thought it was about.
Yeah, that's fine. So the last thing I'll be talking about is snoring. And that's a big issue because it does affect relationships. So usually, we all know what snoring is. For those who don't know, it's just this sound we make when we sleep, okay? And sometimes, especially when you are sleeping close to your spouse, it could be very irritating. Let's be honest with ourselves. And sometimes even the spouse will not be able to sleep, and then it becomes a big issue. Now, the good thing about it is that some of them, okay, can actually be treated, okay? And some of them we need help to treat. It's very common, but lifestyle is one important thing that we need to be looking at. When somebody is fat or obese, that's what we call it, then you may want to reduce the weight. And once you reduce the weight, because what happens with snoring is when there's excess fat around here, then at night it collapses and then reduces breathing, and then it becomes snoring, produces that sound. So reduction in weight is very, very important. Again, lifestyle reduction in weight includes eating good food, healthy. Another thing that you can do with people who are snoring is sleep on one particular, on a side, sleep on your side rather than just sleeping flat. Yeah, that does help as well. There are also devices that could help. Okay, if you go to the chemist, if you go to over the counter, they can get you some devices. Just say you want some devices, and what they help is, there are some strips and there are some things you can put in the nose. What they help is that they increase the space, and then they help to in breathing. Okay, for people who have partners with who snore, you can get earplugs as well. Okay, and also it's important, if you feel that you've tried everything or you don't know what else to do, see a doctor, because in some rare occasions somebody may need surgery to help with snoring. For people who have spouses that snore and it gets on the edge, again, empathy, do what you can, what you feel that you can help them with. And if it includes booking an appointment with a doctor, and with us helping our family and friends and spouses with this condition, I just hope everything goes well and we may be able to at least point them in the right direction, or at least have a significant input. Thank you.
Thank you so much for that, Shola. Much, much appreciated. I probably wanted to add in a little bit about when she mentioned about diabetes, about the fact that a partner waking up to urinate a lot during the night can upset a spouse and make them not sleep well. But the highlight of what she said is that we do need to be educated about all these things, and be intentional about our health is so important. And I think I would just leave it at that. Thank you so much for sharing with us in such a short time. I knew it was a huge job. I'll just let Dr. Akin Orunmuyi take over from here, and he's going to be talking about men's health. And I will just introduce him shortly while I get the slides up again. 1 minute. So these are his slides. Dr. Akitunde Orunmuyi is a nuclear physician based in University College Hospital, Ibadan, and he does have some special interest in men's health. He's also a really great friend of mine. So over to you.
Thank you very much for the opportunity to speak. Yeah, we go back. I call you my friend of 22 years. So we go back a long way, and Shola, it's also nice to see you. So I'm talking about health and men's health. And the picture I have here shows 4 generations. So that's great grandpa, grandpa, the son, and then grandson. And that's kind of thing we desire for healthcare for men. So at the end of this talk, we'll understand the health basics for men, and then sexual and reproductive health. I think it's a very touching issue. Fortunately, Shola has talked about it, so we can go to the next slide. So it'll just be like going to the details for men. So what are the important basic things for men? Sleep. I'm starting with sleep because it's so important. I know sometimes men want to be providers for the home, so they're worried about finances, they're worried about certain things, but it's so important that we have to sleep, because when we sleep, our body has that time to reboot or re-energize. So you need minimum of 6 hours sleep every day. I don't care how busy you are, it's so important that you sleep at least 6 hours a day. And the kind of sleep we want, the best sleep is the kind of sleep where you dream. So if you sleep one night and you didn't dream, chances are you didn't sleep very well. And then the diet, Shola has talked about diet. And, daddy of the house, give him 6 pieces of meat, give him every piece of meat in the pot. It's okay, but it's really not healthy. You need to eat a diet that is rich in fruits and vegetables. As much as possible, try to eat 1 vegetable a day. Now, some of us might not be very rich yet to afford one vegetable a day, but then you have to look at what you eat. You don't have to eat so much salt. You don't have to eat so much carbs. You have to have a balanced diet, and then you have to avoid the oils. So if you're from Yoruba land, the oil must sleep on top of but you have to tell mommy that, please, madam, reduce the oil and all that so that you don't build up the cholesterol. Fitness. So there's no point being daddy of the house if I mean, most daddies can kill a chicken. I'm not talking about that kind of fitness. I'm saying you have to take deliberate steps to be fit. So you have to exercise. You have to, if you can lift weights, that's great. If you can't lift weights, you have to walk around. And I'm talking about 30 minutes of brisk walking every day. So going to work from morning till night, sitting on a desk is not work. So that is, you say, I've been working since morning now. Do you think it's easy to lecture people? Yeah, we thank God for work, but I really need you to do exercise, because when you exercise, you move every part of your body, and it also gives time for the mind to work, like think about things. So health checkups. Daddy is always the strong daddy in the house, never goes to the hospital, never sick, never cries, Superman. We bless God for your life. But once you're above the age of 40, you need to have regular checkups. Above the age of 60, there are some times when you need to do some checkups every 6 months. But above the age of 40, the minimum one has to do is check your blood pressure, check your cholesterol, check sugar. For sugar, you're checking your fasting blood sugar, your HB1AC. Those things they're very, very common now, but they're very popular now. And it's just based on the risk factors. So a person who's overweight probably needs to check the sugar more often. But if you're not overweight, like some people I know, then you can do that once every 3 years. So your doctor will be in the best position to tell you how frequently these tests should be done. To live your best life as a man, and this is what I'm really passionate about. What are the troubles that men face day to day? The pressures that we try to act so strong and we don't want to share with our spouses. You have to learn to live your best life. Living your best life is a life that is free of stress, a life that is grounded in God or some belief, faith that you have, and just trying to avoid all the stresses in life. And there's stress in life. Everybody faces stress every day, but it's your ability to handle stress and deal with stress that makes you live your best life. You have to stop smoking if you smoke. Sometimes we don't smoke, but our friends smoke or our spouses smoke. Passive smoking is just as good as smoking. So we have to find ways to reduce the inhalation of smoke, especially from cigarette smoke. And shisha is also smoking. Weed is also smoking if you smoke weed. So we need to stop smoking. I don't even play with that one. There's no reduce it. Shola was being nice by saying reduce it. You have to stop. You have to stop. There's no two ways about it. Okay, so I'll be going to the reproductive and sexual health. And this is where we really have to pay attention. So a lot of people talk about andropause. I was telling someone yesterday I don't believe in it. And I'll tell you why. So for women, the ovaries produce estrogen. It gets to a certain age, the estrogen, that production stops and they suddenly face menopause. For men, we don't really face menopause or andropause, but after the age of 30, our testosterone levels begin to drop as we grow older. It's not such a significant drop, it's like 2% every year. And to be honest, it has no symptoms, or the symptoms are easily confused with other life symptoms. So when a person is going through a midlife crisis, not necessarily because his testosterone has dropped, you want to check his bank account, or maybe he has relationship problems. So I don't really subscribe to andropause, but there's something like that. And it's a myth according to me. But our hormones reduce every year as we grow older. And you feel, it's obvious. When I was 25, I could, do many things and I can't do now. But it's just natural. And I think men need to learn how to cope with this. You would not always be the strong man you are. And that's why the English people say, make hay while the sun shines. The emotional state of a man, the way men are wired, we think we're not emotional beings, but our emotional state can affect our relationships, especially when it comes to sex. So if I'm stressed, if I'm upset, that's not the best time to have sex. It's just not possible because the way we are wired, The hormones that control libido as well are affected by stress and our environment. And then the one that's so important, that is life-threatening, is disease. So if your libido is not coming on, it's not because you're not in the mood. Yes, sometimes you need to go check that you don't have a health problem. So check your blood pressure, check sugar, check cholesterol. If that's fine, do an ECG. Do an ECG to check your heart, because sometimes the earliest sign of chronic disease and chronic stress is a loss of libido for a man. Libido is many things. So every man should have, well, not every man should have, but once in a while you should have an erection for no good reason. That's what I call it. It's called morning glory. But you should just wake up and you're erected and there's no arousal, you're not even thinking, you're probably even fasting. So that's natural. That's your hormones. And that happens between 4 a.m. and 5 a.m. in the morning. So if you don't have that, it might be a sign for you to exercise more, to check your diet, to cut down alcohol. If you drink champagne, if you drink wine, whatever it is, you drink beer, it might be a sign to cut down. For reproduction, it's just the ability of a man to father a child. So male infertility is an issue. It's very common. Actually, 49 to 50% of couples who can have children is because of the man. And this comes from childhood. So mothers who are listening, you have young sons, you want to check, make sure their testes are in the sac. It's 2 tiny balls that should be in the sac. If you don't feel it before your child is 8, then you should see a pediatric surgeon. It's probably undescended. That means it's still very high up, and then they need to do surgery to bring it down. So if that hasn't been checked in childhood and that man grows into adulthood, then naturally he might not be able to have children. There are other factors that have to do with male infertility. There's retrograde ejaculation, there's loss of libido, impotence, that's what we call it. Sometimes a man might not be able to have an erection, but his sperm is still strong enough to have children. So there are different approaches to that. One is to see a doctor for that. The less talked about one is resource incompatibility. That's not a sexual problem per se, it's just a problem in the blood. So if a man is resource positive and his wife is resource negative, usually they will have several abortions, maybe usually have one child, and then will not be able to have subsequent child because of the mix of the blood. For that kind of problem, it's not the end of the marriage. Then you go find a resource negative donor who can donate to your wife, and then you still have children. I know it's new in our culture, but it's some things we have to think about. And then the final part of reproduction is male contraception. There's no point saying I can't wear a condom. So we have to do safe planning and all that. And some men are just not responsible when it comes to reproduction. They have 7, 10 children. You cannot take care of 10 children. So it doesn't make you a bad man. It doesn't make your wife a bad woman if you wear a condom. And if you really want to keep having unprotected sex with your spouse, which is the way God designed it, you might need to consider having a vasectomy. A vasectomy just, cuts off the supply of sperm, and chances of pregnancy are reduced. So with that, we've finished all the sexual reproductive health. There are other issues men need to face. And I think the next slide tells us how to face those issues. Men need to come out and talk about libido. There's no point using Viagra, and we have all sorts of Sagbadewe and those things. I think men like to brag on how much erections they have and stuff like that, but that's not the solution. Sometimes the solution is to really go look for healthcare. And if healthcare is not the problem, that's if all your tests are normal, there's a way we can change the way we think about ourselves and the way we behave. And that's cognitive behavioral therapy. You have to find someone you're responsible to, that you can speak with and open up. Sometimes that person is your wife. I remember a time I was going through a rough patch in my life and I couldn't have an erection. And I called my wife. I said, look, madam, for the next, I don't know how long this is going to last for, but I can't have an erection. And I think she was understanding. She didn't think something was, I did all the health checks. My colleagues were laughing. My ECG was fine. My blood pressure was fine. But I knew what the issue was, and it was something I could not control. Eventually, I prayed about it, and God helped, found a way. But I feel talking about it also helped me not to have any anxiety around sexual performance. Exercise, there's no substitute for exercise. The more you exercise, it builds your muscle, and muscle helps to build testosterone. And there's something called pelvic floor exercise. It's called Kegels. A lot of men think it's only women that should do it, but a man might need to do that, especially the older man who has some urinary incontinence. Urinary incontinence is when you go wee-wee in the toilet, and maybe you finish and you dress up and then some urine still leaks out and wets your pants. It's just weak pelvic floor muscles. And the Kegels exercise, you can Google them, it's very easy to do. And it's very simple, but very effective in controlling urinary continence. So we need to do those core exercises for because sometimes you don't use your waist, especially when you're daddy of the house. You really don't exercise, and those muscles sort of forget what they're supposed to do, and that leads to incontinence. And about intimacy, the truth is the older men grow, testosterone is going down, your pot belly is probably coming out, your wife's libido is growing and yours is going down. So you find a lot of men in their 50s, they're avoiding the bedroom, they're avoiding the other room because the performance is just not like before. Now, this is where foreplay comes to play. Before, I could see, a naked woman and I have an erection immediately. But as you grow older, it doesn't happen that way. There has to be a lot of psyching and toasting and coaxing for that to happen. So the man must understand this is natural. It doesn't make you less a man. It doesn't mean you have a problem. Sometimes it might be a sign of a more serious problem. You need to check testosterone levels. Some men are known to take testosterone. It doesn't really, testosterone has benefits, but not every man can take testosterone. So about intimacy, there has to be more thought and planning to go into it. You also need the foreplay as much as your wife does. So sometimes you need to make a ceremony or a ritual around it. And most times, once that positive mental image is there, I know people in their 90s and are still firing steady, still having sex steady. It's just they understand their body. So you need to be in touch, in tune with your reality. We are no longer the virile strong man, but we can still have a good outing and, madam comes, you come, everybody orgasms, but everybody's happy. So with all this, we've sort of explained what an alcohol is a libido killer. Men think taking alcohol makes them feel high, but really when a man is high, he's quite useless. So you don't need to stay late nights. You need to get home early. Don't drink. If you want to please your madam in the bed, start from the beginning of the day, not to take alcohol, not to take some other libido killers, coffee for some people. It's different for most people, but whatever makes a man high, some people say eating stars, eating onions, eating ginger. So I'm hoping that these tips have helped.
I think he has done justice to it, but I think we missed his last two sentences, but I think he was actually rounding up. So that was a really, really great discussion. He's mentioned something about urine leaking. I just wanted to make a quick comment on that urine leaking can also be a sign of a water infection, which is quite simple. And urine leaking could be urine leaking in a man or urine leaking in a woman. Sorry, I do have a little bit of a special interest with urine things, but just something to note that could also have more than one cause. So it's good to think quite broadly about some of these things. And he's really done justice to this topic, and that's just amazing. Thank you very much, Dr. Orumi, again. And we will be going to the next speaker shortly, and that is Dr. Amy Ivare, and she's going to be talking to us about women's health. She is in obstetrics and gynecology and has for 8 years, 7 or 8 years. Sorry, I'll just meet you all again and hear some voices. Yes, so she's quite experienced. She was actually my boss when I was in obstetrics and gynecology department, and I was following her around like a little puppy. Very, very experienced, always taking charge. So I appreciate her a lot. She's also a mother of 2 children and has had a lot of experience in management. And I'm happy to have her here on the platform. Over to you, Dr. Ivare.
Oh, thank you very much, Timmy. Thanks for inviting me, and thanks for the previous speakers. You guys were amazing. I am going to try and share my screen, so please bear with me for a minute. Oh, it's asking me what to share. Okay, hang on. Share this. Right, can we see that? Can we see that? Sorry, I can't hear you.
Yes, we can see it. Yes, we can see your slides. Yes.
Thank you. So let's get it working. Right, so my lovely friend here told me to speak about women's health and intimacy. Now, that's a really massive topic. Like she says, I've spent, well, over 8 years now trying to figure it out, and I don't think I figured it out really. So I've tried to summarize it to the thing that I think most people complain about, or what people talk about the most, which is usually things about periods, fertility, and menopause. And even in talking about these, I think I would just talk about the common things that affect us, because there's so much to this and I can't cover it all in 20 minutes. So starting with periods, I found this picture on Google, which I thought was quite apt. It covers it quite nicely. Menarche is just a posh way of saying that periods start. There's 11 to 12 years, but anywhere from 8 to 14.
It's just 1 minute. Let me just please, could everyone please mute themselves? Thank you.
Right, so anywhere from 8 to 14 is fine. Before that, it might be too early, and that could be a sign that there are other medical issues that need to be looked at. And after 16, especially if nothing has started, certainly if you haven't had periods or there are no other signs of puberty, then you really ought to take the child to see a doctor, because that could also be signs that maybe they were born slightly differently, or there are other medical things that need to be looked at. And then the menstrual life usually goes on till about age 51 on average. But again, every woman is completely different. No two women will have the same experience. It can start anywhere really after about 45. And some people keep going until their late 50s. We usually do what our mothers and grandmothers did. But again, there is no hard and fast rule to this. If it happens before 40, then it's too early. And again, see your doctor, especially if there are plans for fertility. And not just that, your periods or your hormones are very important for the rest of your health. So even if you don't have plans for fertility or having more children, there are things that your doctor can do to safeguard the rest of your health. So this looks like a very complex picture, but it's just to say everything really starts from the brain. The start of the periods, the start of fertility, all starts from the brain. And the brain releases hormones in a particular manner that go down to the ovaries and the womb down here to tell them, again, this is the main function of all of this, that the body is ready to start bearing children. So the ovaries start producing hormones to tell the womb that we're ready now, anytime now we might be asked to carry a child. So that's how periods come about, and that's really what's happening in that whole thing. This is what the womb and ovaries look like. That's the womb. There's a neck of the womb called the cervix, connects to the vagina, connects to the outside. Tubes are attached to it like this, and ovaries are attached to the sides like this. This is how they sit in the body. So if you cut a woman in half, well, this way, and she looks to the side, that's the bone in the pelvis. That's the bladder that sits right behind that, and it empties down here. The womb sits behind that. That's the vagina coming behind it to open on the outside, and the bowel at the back. Now, this is what's happening when we have a monthly cycle. So hormones come to the ovary starts growing the eggs, it picks the best egg, and that egg ovulates, so it's released. That egg finds its way into the womb, and if it's not ready for a child, or if there's no sperm around to fertilize that and create a baby, then it's passed out of the system. And what's happening with the womb down here is it starts shedding all the preparation that it's made to carry a baby, which is really the lining of the womb that gets thicker. So all that sheds, and then when that's done shedding and more hormones are coming from the next egg that's being produced, then the lining starts growing again. And when that ovulates, the lining is at its thickest here. And again, when there's no sperm to fertilize and no pregnancy, then it goes back again to there and starts bleeding. And this is what's happening to the different hormones. These two are from the brain, these two are coming from the ovaries. This is just the same picture, and I've just put this here to show what's happening. This is the lining of the womb. When there's ovulation, you can see how the lining is getting thicker and thicker, getting ready, lots of blood vessels. And with this, there are lots of hormones that are being produced. And when all of that starts breaking down, all those hormones that are breaking down there as well can cause quite a lot of pain and makes the womb cramp to push out all that blood. So people can have a lot of pain when all that's happening. And we take it for granted because women just tend to turn up and do what they're meant to do. But some people, it can really affect them. So 90% of women will have significant symptoms, period symptoms, and about 1 in 3 of those might struggle to actually do the normal things that they would do in the rest of the cycle. So going to work, going to school, physical stuff that they normally do around the house, it can be really difficult to get up and get going again. So at those times, it's probably when they need the most help from people around. This is just a picture to demonstrate how much our hormones change throughout a normal month. And this is what women deal with every single day. So they're pretty amazing to just turn up and keep going, because hormones affect everything about you. They affect how you look at life. Both of us can see, the same thing happen. And depending on where I am in this cycle, I might feel really excited about it. I might not feel anything about it, or I'll suddenly burst out crying. And it's all affected by these, okay? So if you're sitting at home with your wife and thinking, why on earth is she doing this again? Please just stop for a second and think. And sometimes just a positive word, or going out for a walk, or helping her out with cooking or the children can, change that completely. Now, I found this picture as well on Google, and it's really amazing because it just breaks down the different ways that we can be affected at different points of the cycle. So this part called the luteal phase at the beginning, just before the bleeding happens, people can feel low, the skin starts to break out, the breasts are tender, they start eating a lot, they feel bloated, they're tired, their body temperature goes up, so they're hot and bothered, they don't want to talk to you, they don't want to go out. So these are all things to bear in mind. When they start having a period, or when they're bleeding, the skin is even drying again.
Sorry, one moment. I just want to see that we're all muted, please. Could we please all mute ourselves? Thank you. Please go ahead. Thank you.
Thanks. And then for the week after the bleeding stops, then the metabolism kicks up again. They start breaking down what they've collected before. So you probably feel that's the time when you're least bloated. The skin looks great. All those pimples have gone. You feel energetic. You're positive. You can conquer the world. And then after that, you ovulate and things just change again. So you see how week to week, everything is changing. Now, what I didn't say about periods, and what I get a lot of questions about, is the length of the period. So when we grow up, especially in my slide here, I'm very conscious, it says day 1 to 28. Now, this is what's called an average cycle. I have never seen a woman who has an average cycle every month. So what's more common is that people have a variation of this, but anywhere from 21 to 40 days is normal. So this can go on, can stretch. So you can have a bleed every 21 days, you can have a bleed every 40 days. As long as it's regular and the amount is not so much that it lands you in hospital with anemia and blood transfusions every month, that's normal, okay? The length of time that people bleed as well is very variable. So in this slide, it says about 7 days, but anywhere from 2 to 7 days is normal. Textbooks say the average is 3 to 5 days. Again, you rarely see anybody who has exactly that. Okay. Right, so going on to fertility, I'm sorry, that was a very quick stop for periods. There are lots of other questions about periods, I know, but I can't cover them all. Maybe specific questions tomorrow I can answer. Fertility, again, uses exactly the same principle. Like I said, periods are there and everything gets started to bear children. But there's a lot of other things that go into having those children. So as I've mentioned, you need the brain, you need the hormones in the brain, you need all the structures that produce those hormones to be working. Those hormones need to make their way down to the ovaries in the right time, in the right fashion. That can also not work so well for some people. In the ovary, you need enough eggs. Now, some people aren't born with exactly the same number as everybody else. Some people's ovaries use them up differently to other people. Some people are born with parts of this whole system missing. So there may not be an ovary there, there may not be any ovary there. You then need that ovary to release that egg in the right time. So if you've got cysts in the ovaries, very really large cysts, if you've got something called endometriosis, which is where the lining of the womb finds itself in here for some reason, that may not work so well. The egg may not be able to get out. And when the egg gets out, it needs to make its way into the tube. This process might be disrupted because the tube is a very, very fragile structure, very sensitive. Anything could disturb that tube. So to start with, some people may not have the tubes. Some people may have tubes that are already disrupted when they're born. Some people may have had previous infections. So whether it's sexually transmitted or other pelvic infections. Some people might have had operations in the past. So things like ruptured appendicitis might cause really bad infections around the tube and scar the tube. People have endometriosis, might have scarring in the tube, and that egg just cannot get through. Sometimes the egg gets through, it meets the sperm here, actually. So the sperm has to travel. So the male bits have to be working. The sperm has to be healthy and get in here. And the sperm has to actively swim up here. And this area is not made easy for the sperm. So there's lots of mucus in there, it's acidic. So all those environments, the sperm has to be healthy enough to get through into the tube to fertilize the egg. And then that fertilized egg, which now looks like this, has to make its way back into the womb and grow in there. So if that tube is disrupted at any point, that fertilized egg will not make it past. If the lining of the womb is not thick enough, healthy enough, if this cavity is not healthy enough, so people can have sort of separated linings, so people have a wall in here, some people can have fibroids that poke in here, some people can have polyps that poke in here, some people might have scarring from previous operations, things like cesarean sections, treatment of previous miscarriages, all those can scar the womb. Infections might have scarred it, so it would make that egg difficult to implant in here. So that pregnancy either won't happen because it would then just fall straight out, or it might start to happen and then have a miscarriage. Okay. Another thing I didn't say is for the sperm to fertilize the egg, not only does it have to be healthy, this combination of the two has to be healthy. So if for whatever reason the genes don't quite match up, this will not happen properly. So about 90% of early miscarriages happen because those two genes just didn't match properly in that situation. So 1 in 6 couples will struggle to get pregnant. Okay, it's very common. If you have 5 friends, one of you will be struggling. So it's really important to be aware of it. I know a lot of us, it's a cultural thing. As soon as people get married, we start going, when's the baby coming? You know, or we have one and we go, oh, when's the brother coming? And when's the sister coming? And we don't know what people are going through. So it's really important, I think, to be sensitive. I think it will come hard to us because it's just something that we do, you know, things that people do to us, things that we do to other people. I have to stop myself a lot from asking, you know, people I've just met, oh, do you have any children? You know, and sometimes you can see their faces just fall and they go, oh, not yet. And you think, oh no, and you know, you've just hurt them. You've just brought back all the memories of all the struggles they've had. So I think it's something we really, as a culture, we need to be aware of, and we need to try so much harder, because trying to get pregnant can really take over people's lives, 20, 30 years of people's lives. And it's all encompassing. It's all they can think about. It's all they see when they go to bed, all they see when they wake up. When they go to work, it's all they think about. When they see children, it's all they think about. You know, you go to church, you go to the supermarket, you go to the market, you know, you put on your TV, your relatives come to visit, friends come to visit. It's constantly there. And it's not because you don't want to, it's because you can't. And I think sometimes it's very easy for people to say, oh yeah, but what did you do before that made it impossible now? But as you can see, there's so many different stages, so many different things that can affect that. And I think it's something that we really need to work on. We really need to be better about. Anyway, going back to my slides. If you try to get pregnant after a month, you stop the contraception, you go, oh, we're married now, we're gonna have a baby, and it doesn't happen. This is why. Only if you have 3 people trying, only about 1 of them will get pregnant in that month. It's not because there's anything wrong. This is even in the perfect situation when there are no problems. And that number goes up steadily until a year after trying. More than 90% of those people, if they're trying consistently, and by trying consistently, they're having sex at least 3 times a week, and everything is normal, 90% of them will get pregnant in the first year. So patience. Even when that doesn't happen, these are the possible causes. So sometimes it's to do with the women's bits, and those are the bits I've mentioned before. Sometimes it's to do with men's bits, so about 20% of issues will come from that. Sometimes it's to do with both men and women's bits, other times we just cannot explain it. And in this men and women's bits and combined, there are also medical issues. Excuse me. So we've also mentioned if people have had maybe treatment for things like cancers, some cancers can affect fertility. Some surgeries that you need to be to save your life can affect fertility in the future. Like I said, some people are just born with bits that are different or missing, or genes that are different. Not anything to do with them, or that's just how they came out, and there's nothing you can do about that. It's just finding ways around it, whether it's donors or it's surrogates or it's adoption or fertility treatments, IVF, or even just fertility enhancing medication. But you need to see a doctor, really. Sorry, I know my time's up. I'm almost done. So again, this is just a reminder of all the things that you need in a woman to make it work, and you need a similar amount in a man to make it work. So it's really a miracle that the human race keeps going, bearing in mind all the ways that this could go wrong. And this is just getting pregnant. This is not making it to the end of pregnancy and giving birth. This is just the first bit. So like I mentioned, subfertility, miscarriages, what I didn't say about miscarriages is they are surprisingly common. They're things that women don't talk about a lot because I think for a lot of women, even though they know that they're pregnant and for them it's a baby, because other people haven't seen that pregnancy or that baby, they're not treated as if they've lost anything, but they have. And for some women, especially women who don't go on to have children or go on to have more miscarriages, that can really, really change their lives. It can really affect them in a massive way. So be gentle, and find ways to be kind. I'm sure even if people don't say it to you, at least one of your friends, if not more, or relatives would either be struggling or have struggled before. So 1 in 8 pregnancies ends in a miscarriage. So if 8 of your friends are pregnant, 1 of you will have a miscarriage. If you have 8 pregnancies, the likelihood is 1 of them will be a miscarriage, maybe more. And about 1 in 100 women will have recurrent miscarriages. So they just keep miscarrying for one reason or another. People can feel emotional and physical pain. People can have lots of financial loss and difficulty, especially if they're trying to find reasons for it, or they just have to keep, presenting to hospitals to treat their miscarriages. There's loss of self-esteem. Every other person is having babies, even teenagers who don't want babies are just popping them out. And for some reason, I can't do it. I've done everything right. I've got married. I've done everything they said I should do, but it's just not working. I keep praying and fasting and it's not working. I've gone to every doctor, every miracle person, is not working. What's wrong with me, right? There's stress, there's anger, there's betrayal, there's grief, sadness. There's so much that goes on. And the worst thing is people don't talk about it. And when they do, we don't listen, or we shut them down, or we say, well, why are you worried about that? You have enough money, you should be happy. You can travel, you can love your job, you can adopt, you can do, why are you worrying about this? But it's just trying to imagine if you didn't have that child that you have, if you had to struggle so much, would you be like them? Would you be worse, right? And unfortunately, it can affect relationships, and a lot of people do break up over this. So there's a loss of emotional connection. Sometimes it's just pressure from ourselves or our families. We come from traditions that say you must carry on the line, it's so important. And unfortunately, people get so fixated on this, and it becomes more important than your marriage. It becomes more important than the person that you're meant to be spending your life with. So yeah. This is a graph to say, I didn't want to make this a thing because I think it's too easy to say it all happens because of her age. Women's age does affect fertility. The older you are, the less likely you are to get pregnant. So in your 20s, your fertility is up here. In your 40s, it's here. Over 45, it's down here. Almost impossible to get pregnant by yourself. And the same thing happened, inverse thing happens with abortion or spontaneous abortions or miscarriages. In your 20s, you're very likely to get pregnant, less likely to have a miscarriage. Over 45, not likely to get pregnant, more than 90% miscarriage. Now, last part of our lives, menopause. So,
want me to ban you from TV? Or you can put off that light you keep putting on. Put off that chandelier light now.
Lion, we can hear you.
I'm sorry. I'm so sorry.
Please mute your microphone.
Unfortunately, I can't help with child rearing. Mine do the same. Anyway, menopause. So this is what's happening to our hormones. So this is estrogen in women, the red line that goes up there. That one's testosterone in men. So you can see it slowly declines, like my previous colleague said. But you can see what happens to women's estrogen when they're going through puberty. It shoots up right up there in their 20s. In the 30s, it kind of plateaus, flattens out, and then they get to menopause and it just shoots straight back down. So you're used to having all this level of estrogen, which, controls lots of things. So not just how you feel about things, but affects things like the health of your heart, the health of your brain, your bones, especially so important for your bones, keeping them healthy, stopping you having, fractures or breaking your bone every time you try and run. Also keeps us, I was going to say nice and slim, maybe not so nice and slim after a couple of children, but all that is affected by your hormones. So when that goes, and that goes because we all have a finite amount of eggs, and that's where these hormones come from. And once we've finished releasing them and our body decides that we've passed the stage of bearing children, then that drops. The biggest hormone is called estrogen. These are all the things that it affects. So your libido, your memory, your mental health, your muscle, keeps them strong, keeps your skin smooth and flexible, protects your heart, helps your liver to get rid of cholesterol so it doesn't stay there. That's why women tend to have problems with their cholesterol and hypertension later than men, and that's usually when the hormones have gone off. Keeps the breasts, in the chest, not in the, flat down the tummy. Helps with where your fat storage goes, so in the skin rather than around the middle. Ovulation we've spoken about, and bones. Important for physical intimacy. It keeps the skin of the vagina healthy. So that means the right pH level, so you don't get infections. Keeps the skin thick and moisturized so that it doesn't break down when anything goes into it. So you don't have pain, you don't have thrush, you don't have bleeding. So this is really important for people who want to be sexually active after the menopause. You have to think about ways of either replacing the hormone that's been reduced or use other kind of moisturizing agents down there, and take your time. So we can't be as vigorous as we were when we were 20.
Hello. Looks like we've lost her briefly, right in the middle of this really deep conversation. I'm sure she'll be back shortly, and I hope we're all enjoying these presentations, learning a lot, guzzling it all in. It's been amazing. Thanks to all.